Hello everyone. I am back to my channel. Thank you for visiting my channel. I appreciate you. If you're in my class taking counseling practice, this is for you. Please take notes. I am Dr. Eunice Menja. I am going to take you through this course, the counseling practice. As I said, my introduction is in the previous video, lesson number one. So I'm just going to go straight to the notes on counseling practice, but I just want to tell you that I, I have a lot of background from different scenarios where I have worked in different organizations. And so I usually teach from my experience and also from the information that I have gotten through my education and also training. So thank you for joining. So today I want us to explore some of the counseling theories that are used in the field. These are is the counseling theories, we call them essential frameworks because they guide us in our understanding of our clients' feelings, thoughts, and behavior. They do a very good job in providing the foundation for the intervention or treatment techniques that we usually provide from our to our clients. So we will begin obviously by looking at some of those theories. We know that the counseling theories usually are very structured um, frameworks that I talked about. They are going to help us make sense of the complex human mind and how the human mind impacts human behavior and vice versa. So these counseling theories definitely do offer systematic ways so that we can understand our clients better. I wouldn't advise anyone to go into counseling field without having a foundation or some understanding in some of the counseling theories because every treatment or a counseling session you have, you're going to have to base it on some type of theory. So, the primary purpose of these theories, as I said, is to give us the foundation to be able to develop to develop the techniques and the treatment plans and interventions. They will help us create the effective strategies we are going to apply in order to assist our clients so that they can achieve their personal goals and as well as improve on their mental health. So that is the main purpose, to help clients achieve the goals and improve mental health. So when the clients come into our office, we want to make sure that they establish some type of goals if they don't have any, so that you can apply the theories that we are going to be talking about in this video. I want to start by introducing a very uh, good, or I want to say theorist, one of uh, the founding fathers of psychoanalytic theory. His name is Sigmund Freud, however you say it. He is the one who founded the psychoanalytic theory that helps us to focus on unconscious processes in early childhood experiences, and how those childhood experiences shape individuals' behavior as well as personality. So, the key concepts that we're going to go over, because Freud has done a lot of work in this theory and in other areas when it comes to human development and personality. We're going to cover unconscious mind, which is the part of the mind that holds our theories, our thoughts. that part of the mind that is unconscious also holds our memories and desires that are not within our conscious awareness. So that is a work of the unconscious mind, according to Sigmund Freud. So we also have defense mechanisms. Human beings usually have defense mechanisms. These mechanisms are used to they are used by the ego, because the brain is divided into three sections, which is the ego, id, and superego. So the defense mechanisms are strategies that are used by the ego to protect itself from anxiety. So you've heard somebody says that I am in denial, I'm repressing bad memories. So that is part of the defense mechanism that is applied by the ego. And it's basically to protect us from feeling anxious about what we have experienced and maybe the pain that we have encountered. The other concept is psychosexual stages, where Freud talks about the developmental stages of a human being. The oral stage is usually the early stage between 0 to 2 years, the inner stage, phallic latency, genital. Um, and Freud talks about how how usually there's conflict that arises, and this conflict must be resolved for healthy personality development in childhood. So when the child is going through these stages, because they are usually in conflict with each other, this that conflict has to be resolved so that there is development of a healthy personality in human being. And these are the words of Freud, Sigmund. Um, there's a lot of people that have different, perception when it comes to human development. So the counseling theories, when we talk about the practical applications of the psychoanalytic theory, there is something that we call free association. So this technique is going to involve clients saying whatever comes into mind. They do not censor whatever information comes out of their mind. I mean, out of their mouth is whatever is in their mind. So we call it free association. This idea is that this spontaneous flow of thoughts is going to reveal the unconscious material. Remember, we talked about the unconscious mind. So, for example, a client might start talking about their day. When they come to your office, they might just ask them about their day. How was your day? How was your drive here? How was your walk to the clinic? But suddenly they might start mentioning about how they had a rough childhood. They might connect your question of how was your day to maybe something that happened in their early childhood. They might talk about, oh, it made me feel how I felt when I was walking to school. And then they might start giving you everything, mentioning about everything that troubled them in their childhood memory, in their childhood, which is going to help you figure out how to help this client. Maybe they have had childhood trauma that they would never have talked about if you never asked that question. So that's what you're calling the free association. Dream analysis. Freud believed that dreams are the royal road to the unconscious. By interpreting dreams, therapists can help uncover hidden desires and conflicts. So, if somebody is struggling with maybe some desires that they have, maybe it is pornography or other conflicts that they may have, maybe they never resolve those conflicts during the early early stages of personality development. So they might talk about having a recurring dream about, you know, being chased, might, at night, which might actually be talking about maybe they were caught doing something, sexually or something illegal that they're not supposed to be doing. But when you talk about it further with the therapist, might come out that they are talking about some type of unresolved fear or anxiety that they've had whenever they were a child. Freud talks about the young boys being in conflict with their father because the young boy admires their father sexually. So somebody might say, "Oh, I had a dream my father chasing me," or something like that. Then you could probably connect to what Freud talks about, that type of conflict. Transference. This occurs when clients project their feelings. They may have heard about important people in their lives. Maybe they had a conflict or they feel bad about the way they are treated by their father, and maybe you are a male therapist. For so a client might start feeling irrational or expressing those irrational anger towards you. That's not personal. They could be reflecting on unresolved issues that the client may have or might be having with a parent, and it is important that you talk about it with your client. So, in summary, psychoanalytic theory offers practical insights into the unconscious mind and its influence on how human behaves. Therapists or counselors that use this theory will be able to help the client uncover those unresolved, deep seated or deep rooted issues by using the free association, dream analysis, and as well as understanding the transference whenever it occurs. And the ego operates on remember how we talked about the egoid and personality. The ego on is going to be or usually operates on the reality principle and mediates between the demands of the id, the superego, and the external world. So what ego does is that it seeks to balance that conflict or conflicting desires of the id and the moral standards of the superego, while also satisfying the basic needs in a socially acceptable manner. So the ego might weigh the consequences of stealing against the immediate desire of the item. If maybe a kid could be walking and maybe see something golden shining, the ego is saying, "Yeah, you go get it. You need this." That the id might be saying, "You need that." You need to feel great about having that trophy in your house. It's going to feel good. So the ego is going to weigh the consequences of stealing that item, uh, against the immediate desire of having that item. So the consequences might be going to jail. So the ego says, "No, no, no, we're gonna get punished." So it considers factors like the risk of getting caught, the potential punishment, or even going to jail, and that is the long term impact that it may have on someone who decides to steal something. So the temptation to steal the trophy is going to be, is going to stop because the ego says, there are going to be consequences. So in this example, the ego is being the defense mechanism. Let's not steal because you're going to be in trouble. So the ego obviously also becomes the mediator because it's helping balance the beam between the impulsive id and the strict superego that says, well, in our culture, we do not steal without asking for something. And that creates harmony and, of course, then we live according to the reality. No stealing. That's what the ego says. So as I give an example of the id, how it operates on the pleasure principle, seeking that immediate gratification of stealing without considering the consequences. So the id, what it does, it prioritizes on fulfilling those desires and impulses, regardless of what is going to happen if you steal. So the moral considerations, that's not what they does not have moral considerations. So the aid might be urging you or someone to steal somebody's wallet or money, that is pickpocketing, simply because they want to have money in their pocket. They have that desire, immediate gratification, as we talked about. No consideration of the moral implications or consequences. So in this case, the it is like that impatient child that is always seeking immediate pleasure and gratification, and of course, without considering that consequences that may happen. Um, so when we talk about the superego represents internalized societal and parental standards. So it acts as a moral compass or conscience. It is the one that strives to perfect our behavior, enforces the moral standards and ideals through feelings of guilt and shame. So, if you've ever felt like you wanted to steal something, or if you have ever done something wrong, and then you start feeling all this guilt and shame, that's the superego working. So you picture the superego as a strict parent in our minds that's always reminding us, you don't do that, you don't take somebody's item. So it sets high moral standards, and it's continuously judging our actions based on these standards. So if someone is considering, stealing on an exam, the superego may evoke those feelings of guilt, reminds you of the moral implications. You might be embarrassed, you might not graduate, you might be told to repeat the whole entire year of the school. So if you're in college, don't do this. Listen to your superego. So in this case, the superego reinforces moral standards and discourages the immoral behavior that is driven by the id. So the interplay between ego, id, and superego could influence our decision making process, and obviously keeping us safe morally. So I hope you got that. So the superego is the moral police, enforcing the high standards and ideals, and guides our behavior through feelings of guilt and shame. I'm gonna repeat that. So the superego is obviously going to make sure that it reminds you what you're not supposed to do and what you're supposed to do. So understand the motivation, the motivation behind, the ego, the superego and the id, so that you can stay safe. Okay. So counseling theories, as we continue to talk about the counseling theories, we also talked about ego, the defense mechanism. This time we talked about the ego being what protects us. So ego defense mechanism in psychoanalytic theory, and obviously the defense mechanisms being called the unconscious psychological strategies that the ego uses, and this is to help us manage our anxiety. Sometimes we feel anxiety, we want to and we need protection, and so the protection comes from our defense mechanism, which are applied by the ego. Sometimes you feel like, you feel sad, you feel like you are angry, you want to punch somebody. Guess what? The defense mechanism kicks in. Denial involves refusing to accept reality or facts that are too uncomfortable to acknowledge. Maybe you have heard when somebody has, you've been told about sad news, somebody died, and you are in denial. You don't want to believe that. That's really the ego trying to protect you from that heartbreak. So you might have heard maybe a person that was diagnosed with terminal illness, and they continue to believe that they don't have any sickness. They are not sick, and they are not going to seek medication because they have denied the fact that they have a terminal illness, because it's sad to hear that you have a terminal illness. Sublimation entails redirecting those unacceptable impulses or desires into socially acceptable activities or behavior. For example, someone that is has aggressive tendencies, they some people like fighting. Sometimes it's the physical fighting or the emotional fighting, and instead of going to fight with real people, they decide to channel that negative energy into something like a competitive sport, whereby they can be competing with others, punching the ball or kickboxing, and that's what is sublimation is about. Displacement involves shifting feelings from an acceptable target to a more acceptable or less threatening one. You've heard of when the parents, when your parents came home, you don't know what made them mad or angry at their place of work, and they just came home and they started beating you out of no reason, out of their frustration from outside. So you might also have an employee who is going to receive very negative criticism from their boss because maybe their boss had an argument at home or their child was misbehaving as you drove them to school. And then when they come to work, their frustration is on you, but there's nothing that you did. That's called displacement. We also use humor as a defense mechanism. Sometimes it allows us to cope with stress or anxiety through amusement. I am one of those people that actually try to find humor when I am disappointed. And, sometimes I get in trouble because I laughed and used humor, and maybe somebody thought that I was laughing at them. But really, it's my defense mechanism. Somebody might say, "You failed the test." Huh? You mean I failed that test? I am so happy that I failed that test because now I get to study more and I get to, learn more as I study the second time, something like that. So it's part of your defense mechanism. You make things lighter than they're supposed to be. It's a difficult situation, laugh about it, and, pick up your other pieces and go and correct your mistakes. That can help you, can really defend you from feeling very uncomfortable and that shame and guilt for failing an exam, and you just say, wow, I get to have some more time in the library. Happy me, something like that. And that's okay too, but just make sure that somebody doesn't think that you're undermining them. So the reaction formation occurs when individuals express the opposite of their true feelings or impulses as a defense against anxiety. You have somebody who harbors unconscious hostility towards a colleague, and instead they express exaggerated friendliness towards them. You've ever had somebody you fought with and they come, yeah, hey, how are you doing? How was your night? I hope you're doing okay. You know, you might be wanna be very careful when receiving such compliments with somebody you just fought with because they are just doing that reaction formation. They express the opposite of true feelings because they want to protect themselves. They don't want to come and start fighting again. So, in summary, ego defense mechanisms will continue to play a crucial role in protecting your clients and even yourself from that overwhelming anxiety. So it's very, very important for you to be able to know when your clients are trying to cope using defense mechanisms and they're not really uh, telling you the whole situation or the whole picture of what is going on when they come into your office. If they tell you things like that, if you see somebody laughing but they're supposed to be crying, then it might be they're using their ego to protect themselves. And it's very important that you discuss these defense mechanisms with your client. So there's more. Obviously, there are more. There are tons of defense mechanisms that are used. The other one, we have rationalization, which is entails creating logical explanations or justifications to make unacceptable behavior or feelings seem reasonable. So you might have someone who justifies, is always justifying their why they did what they did, but they're not trying to justify to make you feel better or worse. It's probably they're just trying to defend themselves. That's their defense mechanism. They did something wrong and they continue to justify. You might also find yourself justifying for something that you did, even to yourself. Projection involves attributing one's own unacceptable thoughts. It's almost kind of like transference, but this one is when you project your unacceptable thoughts or feelings or motives toward others. A person who is dishonest may accuse others of being dishonest. So that is projection. So you have a husband who is dishonest, and they start accusing their wife of being dishonest. That is part of projection. So regression involves reverting to earlier stages of development in response to stressful situations. We see this in a lot of children, especially in therapy, where maybe you have a 12-year-old that is wetting their bed and they were not wetting their bed before. That is called regression. So they might have experienced something traumatic, or they're dealing with something very, very stressful that makes them to regress. For adults, that try to throw tantrum just like a little kid, they're regressing because they've been caught in a very hard place where they feel very stressed, they don't know what to do, and instead of hurting themselves, they throw a tantrum. So you might find someone who throw a tantrum even when they're an adult. So don't judge them. And you can obviously, if you are in a counseling room with a couple or a parent that bring their child because of regression, now you can talk about this from this perspective. So, as I said, there are many defense mechanisms that you are going to find in those textbooks. But just know that people who don't know how to cope with very difficult situations, or they want to avoid dealing with the anxiety or negative feelings, they will probably be using the defense mechanisms. So the impact of defense mechanisms, it can be harmful or helpful. And this one is going to depend on the context and obviously the frequency of their use. So in terms of helpful aspects, immediate coping, when it is something that has just happened, for example, like somebody just died, it was a tragic accident, somebody that died, and that you can apply, sometimes the brain is going to apply the immediate coping as denial. So defense mechanisms will serve as an immediate purpose of by helping individuals cope with that stressful situation, that traumatic situation, that immediate anxiety. It's supposed to be short term. People should not remain in denial. They should be able to talk about these feelings and this trauma in our with somebody who is qualified or trained. They provide relief from those overwhelming emotions at that particular moment, and they're supposed to be short term. Maintaining stability in situations where defense mechanisms help individuals maintain psychological stability and functioning by temporarily reducing the anxiety levels. That is superb, because you want definitely to make sure that you're stable. As a human being, you need to be stable most of the times, because you can function if you don't have that psychological stability. So if the brain applies those defense mechanisms, it's okay. So when you're talking with clients and you figure out, you need to find out why they applied those mechanisms, whether it was to keep them stable psychologically, or they're supposed to be short term, because if they are prolonged, they definitely become more harmful. The harmful aspects, so obviously the avoidance of reality, while defense mechanisms are going to offer that temporary relief. They will involve that distortion of reality or avoidance of facing the uncomfortable news or the tragic news. And over reliance on defense mechanisms really can hinder personal growth and prevent individuals from addressing those underlying issues. And those underlying issues, if they're not dealt with, they'll probably are going to develop into worse things. That's where we find people getting into depression because they never dealt with the reality. Some defense mechanisms, such as projection or displacement, we also know that could strain relationships, because if you are projecting your anger from work to your children or your spouse, definitely it's going to strain relationship. Or even displacement, by attributing your feelings, to the wrong people, or behaving negatively to the wrong people that never wronged you. That can really cause misunderstanding and obviously conflict, and sometimes marriages break because of that. Inhibition of emotional processing. So continuously relying on defense mechanisms can inhibit the emotional processing and problem solving skills. So we want to make sure that we educate our clients on, over reliance of, defense mechanism. So we want our clients to be able to confront those challenges that they maybe those news that they denied when they come to therapy. And if they are projecting, we make sure that we help them to develop healthier coping strategies that will not strain their relationships forever. In counseling practice, adaptive and maladaptive use impact of defense mechanism impacts individuals' emotional well-being and coping strategies. So we want to make sure that we understand the adaptive versus maladaptive use of defense mechanism, so that we can maladaptive obviously is the opposite of adaptive, so that is dangerous use of defense mechanisms. So defense mechanisms, like many aspects of human behavior, exist on a spectrum of adaptiveness. The moment it leaves, you're not just adapting; it's going to be maladaptive. So it can be, you develop an addiction. You do something that is going to cause problems. It's crucial to recognize that they are not inherently good or bad. Defense mechanisms are not, all good and or bad. Rather, their impact depends on how effective they help us to manage stress or navigate our daily lives. For the protective function in acute stress or trauma, so in our practice, we encounter clients who utilize defense mechanisms as a means of coping with acute stress or trauma. In these situations, defense mechanisms can serve as protective functions, so providing immediate relief and allowing individuals to be able to at least function for the day or a month before we get their issues resolved in counseling. So somebody might continue working because they're in denial. They might continue providing for their family because they're in denial. But when they come into counseling, we need to make sure that those underlying issues that they have been denying about, they're addressed in counseling, so that's why they need support. Making them self-aware, helping them to become self-aware of the underlying issues is very, very important. And that is can only happen if the therapist or clients can be able to foster a very supportive environment as well as non-judgmental, because we don't want to judge our clients. If they feel that they are being judged, we are not being empathetic, we are not showing compassion, they might not be able to express themselves. So we help them develop that self awareness so that they can, once they are aware, then we can also guide them onto developing, some goals, and so that we can also empower them to cultivate, maybe that self awareness, as well as develop healthier coping strategies by helping, guiding them to reflect and explore on the things that they are learning in counseling about their behavior, and also seek support from us and even their um, support system. The ego's role as a defense mechanism, again, I said, plays a very crucial role in mediating the interactions between ego, id, and superego. They help individuals cope with anxiety and manage conflict between the instinctual desires. So the id and the moral status and superego here, how ego defense mechanism interact with ego and superego. As I said, the ego wants you to stay safe and do the right thing, and the id forcing you to do something that is obviously negative or what is not moral, and the superego making sure that reminds you of the standards. So that is the that's where the ego comes in. So the ego employs defense mechanisms to protect us from getting into trouble, and of course, if you're not in trouble, even when it comes to things like if you're drinking, if somebody is drinking alcohol and the id wants you to continue drinking, the ego says no, 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 that's definitely wrong. So that's the defense mechanism will rise in response to the id's desires and impulses, and preventing that conflict from happening so that you can stay safe as a human being. So it's really to protect you. So obviously the role of mediation, and of course the balancing the conflicting demands that are coming from id, so that every human being maintains that psychological equilibrium, which is necessary for for your mental health. All right. So there's another theory that, now that we have finished completed talking about psychoanalytic theory in a nutshell, that was not explicit. I want to talk a little bit about Carl Rogers and Abraham Maslow. When you talk about the humanistic theory emphasizes personal growth, self-actualization, and the inherent goodness of individuals. These the key concepts that maybe you've ever heard somebody say. You're in college, because one day you want to achieve your self-actualization. This The self-actualization is a process of realizing and fulfilling our potential and capabilities. It's about becoming the best version of ourselves. So Maslow's hierarchy of needs places self-actualization at the top of the pyramid, suggesting that once basic needs are met, which is the individual is going to strive to for personal growth. But remember this, that the basic needs have to be met first. Somebody has to feel safe. We discussed the ego earlier, and we discussed the id and superego in the previous slides. So what I wanted to tell you, that each of them contributes to self-actualization in very distinct ways. The ego is going to be mediating between instinctual drives and moral standards. The pursuit of pleasure and avoidance of pain influences personal growth, and the superego's internalized moral standards guiding the ethical behavior. So these are all balancing the internal dynamics and aligning with our authentic values and aspirations. Individuals can progress toward realizing their fullest potential, which is achieving our self actualization. Unconditional positive regard, that is was coined by Carl Rogers. This concept involves accepting and valuing clients without judgment. It means that we have to show complete support and acceptance no matter what the client says or does or looks like. Creating that safe environment, a supportive environment, making sure that our programs, our intervention are client centered, developed by Carl Rogers. This non-directive approach puts the client at the center of the therapeutic process. The therapist provides supportive and empathetic environment, allows our clients to explore and understand their feelings without being directed or judged, because it is self-centered approach. So that means that we have to allow that our clients to achieve their own growth. We guide them, meet their needs, provide their safety, make sure that we help them mend their relationships, and then they will achieve self-esteem and eventually the self-actualization. How do we do this? According to humanistic theory, there are some things that clients expect from us, or therapists are supposed to be doing in order to make sure that whatever those needs are being met, and providing a safe environment for doing counseling. We are providing something we call active listening. This is more than just hearing what the client says, because it involves fully concentrating, understanding, responding, and even remembering what the client is saying. These techniques include nodding. Sometimes we nod, sometimes we shake our head, depending on your culture. We summarize when our client is talking so that we can remind them that we heard what they said, or we can make sure that we actually say what they said and what is important. Sometimes we ask open ended questions to encourage our clients to share more, but that's rather than asking a question of yes and no. We want to encourage open-ended questions when you're doing therapy, so that clients can feel that that free association. So congruence refers to the therapist's genuineness and authenticity. Being congruent means being real and transparent with your clients. It's going to help build rapport, it's going to help build trust with your clients. If a therapist feels confused by a client's statement, it's very, very important that you can be authentic. Just say, I'm not sure I understand what you mean. Could you please tell me more about that so that I can understand where you're coming from? In summary, humanistic theory emphasizes the importance of personal growth and the therapeutic relationship. The therapist creates that supportive environment and that fosters self-actualization. We apply principles such as empathy, active listening, and congruence. I come from a place where we don't really say R and L very right, so I hope you forgive me for that. The next time we meet, obviously in the next slides we will be talking about the theories. But just if you have any questions, don't forget to write those questions in the comment section. There's a very famous theory that almost everybody talks about, and people say CBT. Sometimes we forget what CBT means. CBT, it's cognitive behavioral theory or therapy, commonly known as CBT. It was developed by Aaron Beck and Albert Ellis. CBT is highly effective. It is widely used in so many, in so many scenarios, in so many cases, in treatment. Used approach that focuses on the interplay between our thoughts, behaviors, and feelings, because they depend on each other. They actually talk to each other. Our thoughts talk to our feelings talk to our behaviors, because we feel what we do what we feel or think, or we, you know, cognitive behavioral therapy is their theory is grounded in the idea that our thoughts, feelings, and behaviors are interconnected. So by identifying and changing negative patterns in clients, we can influence their emotions and behaviors in order to improve their mental well-being. Some of the concepts that CBT talks about or usually provides is cognitive distortions. These are irrational or biased ways of thinking that contribute to our emotional distress. Common cognitive distortions usually include overgeneralization, minimization. Sometimes overgeneralizations look like a single event is seen as a never-ending pattern. Also something like catastrophizing, where we expect the worst possible outcome all the time. Because I failed my math test, I'm going to fail my calculus test. I'm going to fail my biology test. Something like that. These are methods, behavioral techniques, obviously, are the methods that are used to help modify those maladaptive behavior. Example of that can be something like exposure therapy, which involves gradually facing feared situations that reduce anxiety and activity scheduling, encourage engaging in positive activities to improve mood. If somebody says that they fear presenting in a group, you know exposure therapy can look like, how about you present to a smaller group? How about you present in front of a mirror, and progress like that. So the more you present, the better you become in presenting, and reduces your anxiety. The cognitive restructuring involves identifying and challenging negative thought patterns. We want to replace the negative patterns with more realistic and balanced thoughts. So a client who says that, I always fail my exams, I always feel like nobody loves me, nobody cares. We want to make sure that we help them restructure those thoughts and replace the negative thoughts with positive thoughts. How about we look at a day when we didn't feel like everybody hated us? Do you have friends? Instead of saying that I don't have friends in school, let's talk about the person that you sat with. Let's talk about the person that you talked to the last time, the person that offered help or a hand. Okay. Um, so some practical applications of CBT or cognitive behavioral therapy or theory. Thought records, those are some of the things that we usually advocate or encourage our clients to do. Thought recording. Clients use a journal to record their thoughts so that they can track how those thoughts and feelings and behavior are interplaying on a different day. This helps them identify patterns and cognitive distortions. A client might write down a situation where they felt very anxious, the thoughts they had before they felt anxious, the thoughts that they had after they felt anxious, and the behavior that followed after feeling anxious. So, reviewing these records with your client may help them see if they were overgeneralizing or if they were catastrophizing the events. And exposure therapy also is a technique that is used to help clients confront their fears gradually, as I talked about. Give an example of presenting to a mirror and then presenting to a small group. Someone with fear of public speaking might start speaking in front of a mirror, or speak to a small group that supports them, and gradually work towards a larger audience. Behavioral activation, This involves encouraging clients to engage in activities they enjoy so that they can find meaning. For example, a client that maybe is struggling with depression might be encouraged to schedule maybe a walk in the park or a visit with a friend, help to break that cycle of being inactive and always thinking about, the bad day and, how they hate their life. So, in summary, cognitive behavioral therapy provides practical tools for understanding and changing negative thought patterns and behaviors. So, by applying these techniques that you've talked about, like, record your thoughts, that's something that I always do tell my clients most of the times to bring a journal or buy a journal. Exposure therapy is something that I'm very familiar with, and things like behavior activation. We help our clients improve their mental health or their well-being by using some of these CBT techniques, and of course there are many other techniques that you're going to come across. So the other one that I'm going to talk about briefly is also one of my favorite is solution focused brief therapy, which is also CFBT. It was developed by Steve D. Chaser and Insno Kim Berg, along with obviously with other colleagues at the Brief Family Therapy Center in Milwaukee, which is in Wisconsin, in the maybe in the early 1970s. This work emphasized the importance of focusing on solutions rather than problems, and utilized clients' existing strengths and resources to achieve their desired outcome in therapy. So when you have a client in your room and you want to use a solution focused brief therapy to help that client, remember, solution focused brief therapy is brief because it is brief, it's short term. This therapeutic approach aims to help clients identify and achieve those goals that they want to achieve, help them write them down or guide them to write those goals down, instead of focusing on the past, the things that that obviously dwelling on the past and dwelling on their previous problems is not going to help. This theory talks about focusing on their strengths. What do they bring to the table? What strengths do your clients have? What are some of the resources that they have? Because sometimes clients, when they are hurting or they are going through some trouble, they never think that they have any strengths. So recognizing and utilizing those existing strengths to develop solutions is what solution focused is talking about. It operates on the belief that every client already has the skills and resources that they need to solve the problem that brought them into the therapy. There's something that we talk about a lot called the miracle question. It is a very powerful technique, a question that you pose to your clients and ask their clients to imagine or close their eyes and imagine um, a miracle happened overnight and their problem was all solved or all gone. They then describe what would be different in their lives if the problem was all solved or the problem was all gone. And it helps them to identify goals and also be able to step towards achieving those goals. Okay, the miracle question. That's something that is obviously very intriguing. Here are some practical applications of focused brief therapy. I talked about setting clear goals. Therapists collaborate with clients to define clear, achievable goals, which we also talk about the specific, measurable, achievable, realistic time bound. This is my favorite to use the SMART goals. SMART. So the specific S stands for specific, M stands for measurable, uh, A stands for achievable, R stands for realistic, and T stands for time bound. A client, maybe for example, I can give a client who struggles with anxiety might set a goal to feel more relaxed and confident in social situations. So you want to help them, achieve, identify some exceptions, when they did not feel anxious, or when they did not feel very, they didn't feel awkward in a situation. That's what you're calling the identify exceptions. Therapist will, the counselor or the therapist will talk with the client and identify maybe a day that that problem was not very severe, and help them understand what was different during that time when the problem was not severe. So these times provide valuable insights for the client and also the therapist. So a client might recall feeling less anxious during a particular social event, and that help them identify what helped them feel comfortable so that they can reuse that strategy. The scaling questions, this involve asking clients to rate their progress or confidence in achieving their goals on a scale of 1 to 10. That is also my other favorite one. When I ask my clients when they come in on a scale of 1 to 10, how stressed do you feel? And maybe at the end, on a stress of 1 to 10, how stressed do you feel before you leave therapy? This helps the clients measure their progress and identify specific steps they need to take. If on a scale of 1 to 10, how close do you feel like you are to your goal? How confident are you that you can handle the next situation by yourself without feeling anxious, and obviously help them move from, if they say they are on a 3, you can say let's see how you can move to 4 and 5 and 6 and maybe eventually 10. So, obviously, in summary, solution focused group therapy is a highly practical approach. It empowers clients to see, to see when they see that the resources are in their hands, they see that the skills that they need to overcome the situations are they're in their hands. They see that they have resources that probably they never thought about. Their grandparents, maybe some money they have saved, or maybe there's a skill that they had that they can use them to solve their problems. So that's how solution focused therapy is all about. But there's much more. If you want to study, I'll provide those resources for you, and those resources are right here. So if you want to read deeper, definitely I would encourage you to look at the resources. For now, thank you so much for watching. If you found this video helpful, please leave a comment below. Share it with a friend. Don't forget to subscribe to my channel for more content. Your feedback and your support mean a lot to me. So help me create even a better, obviously better content by giving me feedback so that other people can benefit. Obviously, I'll see you soon. Bye bye.